A few months ago, the word Delta took over our lives, and now Omicron has now entered our vocabulary too. Lockdowns are back in some parts of the world, and in others, mask mandates have been reinstated. All this while the world gears up to enjoy festivities, celebrate Christmas, get together with family and friends, and even board planes to travel. Vaccinations once again have taken center stage as boosters are now being touted as a miracle escape from the pandemic. Today on this special broadcast of the WION-VOA Co-Production, we will look at America's plan to deal with the same. Remember, Omicron now happens to be the dominant strain in the United States. US President Joe Biden urged people to not panic as he announced an updated three-pronged plan to fight a surge in COVID-19 cases after the emergence of the highly transmissible Omicron variant. He also pleaded with the millions of unvaccinated Americans to get their shots. VOA's Anita Powell reports from the White House. Have a look.
President Joe Biden said Tuesday he has 3 tools to fight the rapid spread of COVID-19's formidable Omicron variant. The administration will increase support for hospitals, make 500 million free tests available to Americans, and expand vaccine access. He also encouraged the vaccinated to not panic.
If you're not fully vaccinated, you have good reason to be concerned. You're at a high risk of getting sick. And if you get sick, you're likely to spread it to others, including friends and family. And the unvaccinated have a significantly higher risk of ending up in a hospital or even dying. Almost everyone who has died from COVID-19 in the past many months has been unvaccinated. Unvaccinated. But if you're among the majority of Americans who are fully vaccinated, and especially if you've gotten the booster shot, that third shot, you have much less reason to worry.
Biden acknowledged that persuading the holdouts, about 40% of Americans are completely unvaccinated, is an enduring challenge for his administration.
Look, the unvaccinated are responsible for their own choices. But those choices have been fueled by dangerous misinformation on cable TV and social media. You know, these companies and personalities are making money by peddling lies and allowing misinformation that can kill their own customers and their own supporters. It's wrong. It's immoral. I call on the purveyors of these lies and misinformation to stop it. Stop it now.
In recent days, an unlikely pro-vaccine ally has emerged, former President Donald Trump. He recently admitted he had received a booster shot and was booed for it by some of his followers.
It may be one of the few things he and I agree on. People with booster shots are highly protected. Join them. Join us.
But critics say this push for boosters is unjust when many around the world have yet to get a single shot. On Tuesday, the WION campaign, a health policy advocacy organization, warned that there is no way to hit the target of vaccinating 40% of the world's population by the end of the year, and that it could take more than a decade for low-income countries to match the vaccination levels of high-income countries.
We are absolutely not winning the global war against the pandemic, as evidenced by Omicron. But of course, Delta showed us that, and the original virus showed us that. The lack of global leadership, the lack of coordinated leadership among countries, the me-first reaction by every, government leader during the first 2 years of this pandemic has meant that it has continued on longer at the cost of more lives and more livelihoods. It's very clear what needs to happen. A national-only strategy will not work.
Critics also decry wealthy nations for hoarding essential supplies. On Tuesday, Biden defended the U.S. decision to stockpile protective equipment and ventilators as necessary to prepare for a run on hospitals. This week, as Americans stare down this threat, Biden sought to put a balm on his weary nation.
I know you're tired. I really mean this, and I know you're frustrated. We all want this to be over, but we're still in it. And this is a critical moment. We also have more tools than we've ever had before. We're ready. We'll get through this.
Anita Powell, VOA News, the White House.
Let's now cut across to Washington, from where Voice of America correspondent Chris Casquejo now joins us live. Chris, thanks for joining us on this special broadcast. As we know, U.S. President Joe Biden is now promising to ramp up COVID-19 testing, but those efforts won't come in time for the holiday travelers who want to know if they're infected in the first place so that they can travel. What can they do to ensure the safety of their family members so that they can plan any kind of outings or get-togethers in the festive period?
Unfortunately, not much other than masking and social distancing, unless they're willing to wait in long lines at a testing center or they can get a COVID test at a retail location like a drugstore. But shoppers in those places are greeted with empty shelves in many cases. So two big chains are taking action. Walgreens said it's limiting people to 4 boxes per purchase in-store and online. CVS said it's limiting people to 6 kits per purchase. Manufacturers are working to increase supplies of tests. Pharmaceutical company Abbott plans to expand production to 70 million tests in January, up from 50 million this month. But experts say the latest effort still will not be enough for all Americans to test twice a week like they do in Germany and the UK. The nonprofit Kaiser Family Foundation says the U.S. would need 2.3 billion tests per month for everyone 12 and older to test twice weekly. In the United States, infections average around 149,000 a day, and that's up from 75,000 at the start of November.
Right, Chris, my second question for you. Now, the availability of test kits remains a huge contentious issue in the United States as of now. But some promising news came out this week regarding new treatments, especially for COVID-19, with 2 companies offering pills for treatment. How soon will these be available?
The U.S. Food and Drug Administration, or FDA, has authorized emergency use for COVID pills from Pfizer and Merck. Let's start with Pfizer. The company says the pill, which is to be taken with another antiviral drug, is 90% effective at preventing hospitalization and death in high-risk people. This pill is the first at-home treatment for the virus, and it's approved for use in those 12 and older who are at high risk. Now, Pfizer says it's ready to start delivery of the drug immediately in the U.S., and it will produce 120 million courses next year. The FDA also granted emergency use authorization to Merck, but its pill is reportedly only 1/3 as effective as Pfizer's and is not approved for those under 18. It also carries a warning for pregnant women. And it costs $700 per course. A course of the drug requires patients to take 4 pills twice a day for 5 days. Health officials say that getting a vaccine is still the best way to stave off the worst effects of the coronavirus.
Chris, thank you so much for all these inputs. Stay with us on this broadcast. We'd like to talk to you a little bit more about what people are doing to counter the Omicron surge in the United States, especially at a time when they want to travel and get together with family. Now, as we just said, it is the holiday season in the United States, and much of the country is now celebrating Christmas Eve. For many, that means it's time to sing Christmas songs, even for those from different religions. Voice of America brings you more details in this next report. Have a look.
Dewa Dirga and Kit Hopkins Dirga are a couple in the Washington suburbs. Since moving to their Centerville, Virginia neighborhood in 2016, they've taken part in Christmas caroling around their neighborhood. For Kate, it's a fun reminder of her childhood.
So when I was growing up in our neighborhood, I have a lot of good memories of our entire neighborhood getting together to go Christmas caroling. And there was one family that would always host an after party with cookies and hot cocoa, and I'm sure the adults had something else, but the kids would really enjoy the treats after caroling.
The activity also stirs warm memories of neighborly togetherness for Dewa, even though he grew up in Bali, Indonesia.
Saya itu kan bukan orang Kristen ya, saya orang Hindu.
I am not a Christian, but a Hindu. But I enjoy celebrating Christmas to support my wife and the whole family. So I just participate in the festivities.
Jadi kita mendukung aja gitu, berpartisipasi.
Every year, the two are joined by their neighbors Jill and Joss Pauline.
Oh, sure. It's so much fun. We have great neighbors, and it's just been like a fun experience for all of us to get together and spread Christmas cheer.
Just a great way for neighbors to get together and have a good time.
You don't need to prepare or rehearse to join this neighborhood choir. Just bring some holiday and neighborly cheer.
I think we all come here not to be the best singers. We're excited to come together and sing off-key or on-key and just to spread joy to the season, to our neighborhood.
As an initiator of this holiday tradition, Kit also gets to choose the songs.
The first year we had a packet And that did not work out well because nobody could find the right song in the packet. So we tried to narrow it down. So this year I just picked 10 songs that we really like. Some are secular and some are a little bit more religious, like Silent Night, The First Noel.
This year, most neighbors are comfortable sharing in some physically distanced but socially engaging cheer.
I wish everyone a happy holidays and health and
peace. Happiness and peace. We so enjoyed the caroling. It was just beautiful. The children were wonderful.
Thank you so much.
Stroll the ancient Yuletide carol.
And after an evening of caroling, the carolers go back to Dirga's home and share more holiday spirit. And of course, some hot cocoa. From Centerville, Virginia, Marioni Maria Iman Santoso, VOA News.
Some heartwarming stories right there. We still have Voice of America correspondent Chris Casquejo with us on this broadcast from Washington. Chris, my next question for you. Millions of Americans are now traveling to see their family members for Christmas, especially in the holiday period. How do these numbers compare with previous years? We will get our correspondent Chris back as soon as possible on this broadcast. For now, the story that we are tackling in this broadcast is about the Omicron surge, especially during the festive period, the holiday season, especially in America. The Omicron variant is now the dominant strain in the United States. At the same time, people want to travel. They are boarding flights. They are traveling to go see their family members and gather for Christmas and New Year's celebrations. And the U.S. is now struggling to curb its COVID-19 surge, especially due to the contagious Omicron variant. Earlier, U.S. President Joe Biden had urged people to not panic as he announced an updated three-pronged plan to fight the surge in COVID-19 cases after the emergence of the Omicron variant. He pleaded with Americans to get vaccinated as soon as possible, get their booster shots, which once again have been touted as the way out of this pandemic. President Biden earlier said that he had three primary tools to fight the rapid spread of the Omicron variant. Testing, of course, is one crucial method. And, of course, increasing support for the healthcare facilities in the country is another. Now, we have our correspondent, the VOA correspondent, Chris Casquejo, back on this broadcast with us at this hour. Chris, welcome back. Now, the holiday season can be a difficult time for people without families or even a place to live. But many communities are now making efforts to help these people, especially during the holiday season. What can you tell us about them?
Well, you know, some of the homeless people in LA, they need help. And Russian-speaking retirees in Los Angeles created dozens of paintings to offer these homeless residents of this shelter hope this holiday season. And each piece of artwork carried a special message that the homeless are not alone. Now, some of this art was displayed at an exhibition at the shelter. Now, more than 50,000 people in Los Angeles County alone, where LA is, are experiencing homelessness, and the number of older homeless is growing, an increase of 22%, age 62 and older. Now, experts say art therapy like this is important to help the homeless who are recovering from some kind of trauma in their lives, be it job loss, violence, or something else. Priyanka?
Right, Chris, just talking about the holiday season, especially at a time when people want to travel. They want to travel to see their family members for Christmas. But how do the numbers compare with previous years? That, of course, is a big question.
Now, the American Automobile Association, AAA, forecasted more than 109 million people, almost 34% increase over last year, will travel 50 miles or more as they hit the road, board airplanes, or take other transportation out of town between December 23rd and January 2nd. Now, yesterday, some major airports reported the number of passengers was actually at pre-pandemic levels, or actually higher than pre-pandemic levels. Now, AAA predicts airlines will see an 184% increase from last year. And that shows that people are actually willing to travel to see their relatives and friends this holiday season, despite the Omicron variant. Now, as far as where people are headed, AAA booking data through October shows that domestically, theme park heavy destinations like Orlando and Anaheim, California, top the list of popular travel spots in the U.S. Las Vegas, New York City, and several other Florida cities also rank high, presumably because of the warmer weather in Florida. Priyanka?
Chris, thank you so much for all those inputs, and thank you for joining us on WION at this hour. And here's wishing you a very Merry Christmas from all of us here at WION.